Hello, my name is Ingigerdur Sverrisdottir. I'm a MD at the Sahlgrenska University Hospital in Sweden, as well as a PhD student at the University of Iceland. And the title of my study is Autoimmune diseases are not associated with monoclonal gammopathy of undetermined significance, results of the prospective iStopMM study. So this is a nested study within the iStopMM study, which I will introduce a little bit better. So we have in the iStopMM study screened over 75,000 individuals for MGUS, and we have over 80,000 participants already. This study was started in 2016 and is aimed to answer the question if a screening for MGUS will help in treating myeloma earlier, or even finding factors that contribute to MGUS developing into myeloma. But this is a by study where we use the data that we have already obtained. So MGUS individuals were found and then randomization into 3 arms. And we take all the individuals in the study that have MGUS and look at them in this study. So it has previously been shown that monoclonal gammopathy of undetermined significance is a precursor of myeloma and related conditions. Previous registry-based studies and retrospective case studies have proposed an increased risk of MGUS among patients with autoimmune diseases. However, the clinical diagnosis of MGUS is made by definition when we're investigating the cause of unrelated symptoms, and therefore prior studies have been unable to control for selection bias. The true relationship between MGUS and autoimmune diseases remains therefore unknown and can only be evaluated in a screening study. So we aim to examine whether autoimmune diseases are associated with MGUS in a screened population. We used the iStopMM database, as previously mentioned, and we have screened over 75,000 individuals with 80,000 individuals participating, representing 54% of the Icelandic population. And we screen them by using serum protein electrophoresis, or SPEP, and the free light chain assay to identify those individuals with a previous clinical diagnosis of MGUS, that is, those individuals that had MGUS prior to enrolling into the study. We used records from laboratories performing SPEP in Iceland and cross-referenced them with the Icelandic Cancer Registry. And then we found all diagnoses of autoimmune diseases in the Icelandic Hospital Register and the primary healthcare contacts from 1999 to 2020. Statistical analysis was performed with t-test and chi-square test, as well as logistic regression to calculate odds ratios of having an autoimmune disease with different MGUS groups. And we compared individuals without any MGUS, that is, all those enrolled in the study without a previous diagnosis of MGUS or a screened MGUS when they come into the study. And we compared those with no MGUS whatsoever to those individuals with a previous MGUS diagnosis, that is something that they got before enrolling into the study, and also to those individuals that were diagnosed with MGUS in the iStopMM trial. This is just a list of the registries that we have. We have the patient registry, the cancer registry, and laboratory registry, and we even have access to the prescription registry if we want to look further into a medicine that people are taking. We have validated the coding of the Icelandic registries with over 96% accuracy. And we have now found in the iStopMM study over 3,400 patients with MGUS that we follow up. We use IMG WG recommendations, or we do intensive follow-up. These are the results if we take together all the individuals that we have found. So we found individuals with MGUS by screening. They were 3,824. Light chain MGUS by screening were 312. 338 had previous diagnosis of MGUS, and if you combine these groups, we have 3,358 with MGUS and 316 with light chain MGUS. 71,505 individuals did not have any MGUS whatsoever. We can see that in all MGUS groups, they were predominantly male. Compared to in all participants in the study, we had females being over 54%. So there's a difference there. As well as in the age, the median was higher for MGUS individuals compared to all participants. And looking at the diagnosis of any autoimmune disease, we can see that those with a clinical MGUS diagnosis, that is a prior MGUS diagnosis to screening, they had a prevalence of autoimmune disease of 28.4% compared to 15 to 16.8 for all other groups. The most common autoimmune diseases were psoriasis, rheumatoid arthritis, polymyalgia rheumatica, diabetes, and arthritis associated with psoriasis. And then we compared the risk of having autoimmune disease within these groups. That is, we conducted a logistic regression model, adjusting for age and gender. And we saw that the risk of having autoimmune disease with these groups was not significant for those diagnosed by screening. And even in those diagnosed by screening and with a previous diagnosis of MGUS combined. The group that stands out is the MGUS groups that is diagnosed clinically, that was diagnosed before they enrolled to the iStopMM study with an odds ratio of 1.98. That was statistically significant. So we conclude in this large prospective population-based screening of over 75,000 individuals that there's no association between MGUS and autoimmune diseases in a screened population, but in sharp contrast, there is a correlation with autoimmune disease in individuals diagnosed in a clinical setting. Our results support the hypothesis that clinical case series and prior registry-based studies that have showed an increased risk of MGUS among patients with autoimmune diseases reflect a selection bias.